But firstly, just to say welcome everyone that's joined, and we've got quite a lot of people on the call today. So rather than going down everybody's name, I think it's probably best that we just start, and then when people have a question, just introduce yourself and where you're from, and then we can have that recorded as well. That would be very helpful. Okay, we've still got a few more people coming in. That's fantastic. So welcome everyone. My name is Christine Footer. I'm the Chief Operating Officer of Norfolk and Suffolk Care Support. Megan, did you want to introduce yourself?
Yes, hi everyone, I'm Megan. I'm the Communications and Admin Executive, and I work for Norfolk and Suffolk Care Support, and I also work for Norfolk Care Association. And just to check, you should now be able to see the agenda, is that right? Brilliant,
yeah,
lovely.
Thank you, Megan. Thank you very much. Thank you. So we have got with us today members from the CCG, the Quality Improvement Nurses. I've got Stephen Long as well from the Quality Assurance Quality Improvement team. We've got Boyka from Public Health as well here. So thank you all for coming. Thank you. We'll go through the questions, or we'll go through the items on the agenda, and I just want people to be able to put any questions that they have so that we can try and answer them for you. And if we can't, we'll take them away and try and get some answers for you afterwards. So the first agenda item we've got here is COVID booster vaccinations and flu vaccinations and the rollout process. So the first question I've got, firstly for care homes, if I can, I want to ask you around whether your residents have now all had their boosters or have the date planned for their boosters. Has anyone still not heard from their health colleagues at all on the call?
Feel free to put anything in the chat or raise your hand. Oh, Zoe's got her hand up.
Thank you, Megan. Zoe, can you come in?
Zoe, you're muted.
Hi, that's actually Carolyn talking on behalf of Zoe. So we're both here together from Fitzroy Support Home in Norwich. Our people that we support haven't had their boosters yet, but there has been sort of communications over the last couple of days about arranging that. So although they've not had it yet, things are moving now with them, and I didn't know whether we were getting a bit concerned because we'd not heard anything about that and the flu vaccinations, but things do seem to be moving a bit now.
Excellent. What we do know is that the homes that hadn't been contacted, there is a plan. There's a plan where GPs and PCNs have come together to identify dates to visit care homes. Some of the plans have been, I wouldn't say derailed, that's not quite right, but some of the plans have been delayed because of supply issues for the vaccine, but also capacity issues within the GP services. So that's been delayed and pushed back. One of the issues that we have raised is that care homes haven't been told about the dates when they should be expecting their visits. So we have tried to escalate this so that we can identify with our CCG colleagues when you are expected to receive a service, with the caveat that there may be still delays around supply or capacity issues, but obviously you should be informed if that's the case. So I'm really pleased that Fitzroy now at least got a date arranged. I presume, have they sent you all the forms to complete for your residents?
Hi, no, we haven't had the forms as yet. We still haven't got a date.
Oh, you still haven't got a date?
No.
Ah, okay. Who contacted you? Was it your GP surgery or PCN? Do you know who contacted you?
It was the NHS contacted us yesterday.
The NHS?
Yes, she was a nurse from Central Point.
Central Point. I wonder if my colleagues from the CCG might be able to come in here. I just wondered if that's a piece of primary care network. Does anybody know who these people are from Central Point?
So it's Rowan here, Christine.
Rowan,
Sorry,
thank you, Rowan.
I'm not sure, but I can find out. Try and find out. I haven't heard of them, I'm afraid.
No, I'm pleased you haven't either, because it's new to me. I didn't know who Central Points are. You know, I do know that. Sorry, Rowan.
And I had a phone call this morning from Norfolk County Council as well that said that they were to get in contact with the residents' surgery to see whether they can chase that up as well.
Right, okay, because I certainly know that there are roving teams. So, for example, if a GP or PCN cannot, either for capacity or stock reasons or whatever, vaccinate, they are trying to get what they call a roving team to visit. So it might be that this is a roving team, but we'll try and find out. But you still haven't been given a date.
Sorry. No, we still haven't got a date as yet.
Okay, and that's flu and booster, isn't it?
I've had all the service users at Northfields are registered with the same medical surgery. 3 out of the 7 have had their flu vaccinations in the past week.
Okay.
And the others are still waiting for those, and nobody's had the boosters as yet.
Right. Okay.
Just seems a lot slower than obviously the first and second lockdown. So.
Yes, absolutely. It is more complicated, obviously, because there are 2 vaccinations and there was the delay about whether they could be co-administered, etc. Then there were some issues about supply with flu vaccinations. So I think there's a combination of reasons why it has taken less time. But can I just double check? Are you a learning disability home?
Yes, we are.
Yes, yeah. So that's another issue. Okay. So the priority has been to vaccinate older people homes first. So they have got the priority. Then under 65s will follow. So it could just be, and I don't mean this could just, but it probably is to do with the fact that they're trying to get through that cohort first and then rolling out to learning disabilities. And I suspect that that's the reason, but it is a lot slower than we had hoped for.
Yeah, thank you.
That's okay. That's okay. Okay, so it just looks like that's the central point. Thank you, Petra. Did you want to come in, Petra? Petra there?
Hello, good morning. I'm
Morning.
just trying to learn a little bit here, so I'm not really there to make any big input or give any big input. I just thought I'd quickly look it up, and it is a possibility that they maybe mean this.
Okay. Well, I'm sure between us all that we'll get somebody to Fitzroy as soon as possible. And it is to do with the process of the rollout, that the care homes, older people care homes, have been prioritised, and then the learning disabilities will follow. And it probably is to do with supply and also capacity. But definitely we'll pick that up. So has anybody else had any issues from the care home first, from a care home setting, in terms of vaccinations for their staff or residents? Can I ask specifically around flu vaccinations? How is that going in care amongst care home staff? Can I ask somebody here? Who shall I go to? Gayatri, how about you? I think, Gayatri, you had quite a good relationship with your GPs, is that right? Are you there, Gayatri?
You are on mute, so if you can come off mute.
Oh, it looks like she might not have the sound again. If you could pop something in the chat box, Gayatri, that would be fabulous if you could. I am going to ask Overbury House. Overbury House.
Yeah.
Hi. How's it going for you in terms of the vaccination, particularly with the staff?
The staff for the flu jabs is a bit slow on the uptake. For the COVID, they've all had that, and the boosters are coming through slowly. All the residents have had their flu jabs.
Oh, excellent. And have they had their boosters as well?
31 of my residents have. I've got about 10 that haven't, but they were like new admissions and things.
Okay, yeah. And have you got a date? Sorry, who am I speaking to? I'm so sorry.
Oh, sorry, you're speaking to Alison, the manager of Overbury House.
Alison, hi Alison. Yeah, so Alison, what about those 10 that haven't had the boosters because they're newer residents? Have you got dates set for them?
Not as yet, because we were in a shutdown at the moment. We had a COVID outbreak. But it's on our top of our list as soon as we open, which hopefully will be this week.
Yes. Oh, I'm so sorry. And obviously anyone that has been tested positive, there is that gap between when they were tested positive and when they can receive their vaccination. So you still have to have that.
Yeah, we do. Yeah.
Okay. Oh, well, fingers crossed that will you'll be able to access that soon. And in terms of the staff, you said it's slower uptake. Is that because the staff themselves are a little bit resistant to the flu vaccination, or don't see it in the same level of importance perhaps as the COVID vaccination and the booster?
Yeah, I think so. That is the case. I know some of my staff have, but to be honest, with everything that's been going on, I haven't monitored who's had the flu vaccine or anything as yet. It's something which on one of my lists of jobs. We've been concentrating on the COVID vaccines and the boosters. So to monitoring who's had the flu jabs, I haven't actually done yet. But I know some have, some haven't.
Okay, because Alison, one of the biggest issues for staff is obviously if the GPs and PCNs don't do the flu vaccinations for staff on site with the residents, and many of them aren't doing that, the staff will then have to seek their own opportunities to get that flu vaccination, and that tends to be their GP surgery, and many GP surgeries may not have or haven't had the right amount of flu vaccines to deliver, or the pharmacy, and sometimes you have to book online, so it can be a little bit slower to do. However, what you may be able to do, and what we're trying to find out, is you can go to a community pharmacist and ask them if they would come in and vaccinate your staff on site, because some community pharmacists will do that. Okay, so that's another option for you. All right. We are trying to look, I don't know, Stephen, whether you know, but we are trying to get a list of community pharmacists that could offer this service as well, but that might assist.
Okay, yeah, that would be, yes, I'll look into that.
Okay. Has anybody else got any questions from the care homes? Raj, how are you getting on there? Has everybody had their booster and their flu vaccination? We got 2 Rajes, haven't we?
2.
Yeah, sorry, Raj.
Which one do you want?
Well, I'm, Raj and Raj, both of you. Let's have both of you. Let's start with you, Raj.
As far as I know, I mean, it's all going ahead. We haven't had any issues. I haven't got any up-to-date figures, but I've actually requested them while we were on this call, so I should get those through. But I've had no issues reported. GPs are coming in quite cooperative, been quite proactive this time around with the boosters, and also some are offering the flu jab at the same time.
Excellent.
I've had both mine, so I'm all right.
So you're all right. That's okay. That's fine. Oh, good. Well, that's promising. That's very promising. And
Christine, yes, in my case, everything went smoothly, no problems. We got all the flu jabs done except one person who doesn't want to do it, and including residents. Boosters, all residents are done, and only 2 remaining on the booster from the staff here. Basically, their dates are last vaccine. Yeah, second was not that long, so they can't have it early. Yep.
Okay.
So basically, that's where we are.
Okay, that's fantastic then. That's really, really good. And the flu as well, Raj? The
Yes.
staff are taking up the flu vaccination?
Only one person on staff doesn't want to do it. No, we tried everything possible, but she doesn't want it. So
Yeah.
there you are.
Yeah.
That's her choice.
That's her choice, and the flu vaccination isn't mandatory as yet. So, okay. Well, that's really promising. That's really
Great. Yeah, thank you.
Yeah, no, it's really good. Thank you, Raj. And can I just check, Robert? Can I just check with you, Robert? How are things there with you? Oh, you're just on mute, Robert. Just on mute. That's it. It's a pain, isn't it? I think that's it, Robert. That's it. We've got you now. Lovely.
Oh, well, all along I've been wondering whether it's the right platform for ourselves, because we are a recruitment agency. So
okay.
Yes. So is it the right platform for us or not? But I don't know how our name ended up here.
Well, Robert.
Yeah.
A recruitment agency. I would expect your staff would come under like the general population in terms of accessing the flu and the booster vaccination. So, well, the booster, they would definitely be a priority.
Yeah, we
just book it online. That's quite easy. For the flu vaccination, you'll be exactly the same as all the staff in the care homes that don't get it delivered on site, that your staff will have to go to community pharmacies to get the flu vaccination. So what we will do is we'll drop a link in the notes after the meeting, which will give you a list of community pharmacists as well. So there's an NHS list that you can look at, but it is tricky because it's basically go to your GP or your pharmacist. So
Absolutely.
sorry, I can't give you better news than that, Robert. I'm so sorry. But
that's what we've been doing, encouraging them to book online. Although most of the workers, they were sort of, reluctant to come forward in the first place, but now I think with the legislation kicked in, most of them realize that is something that needs to be done. Now some have been caught in between. They've had the first dose. Now they have to wait for the second dose before we send them out to work. Yeah.
There is something around for the first and the second dose. You can bring that period forward slightly for the second dose, depending on clinical approval. But we had this last time, and Boyka, I'm sure Boyka can explain, but it can be brought forward as depending on which is the first vaccination they had, if it's Pfizer or if it's AZ, either 21 days or 28 days after that first vaccination. So it can be brought forward if they're in that sort of cohort of healthcare workers, social care workers that need it. So that's something to bear in mind. It can be brought forward.
I will have a look. I'll chase on some of them. Yeah.
Okay. I just noted a couple of things here in the chat box. Gayatri, all mine had flu vaccinations and had booster except one because the nurse didn't want to open the vaccine pack for one. She said she will be back, but we haven't heard yet. Gayatri, I think we probably need to pick that up and just make sure that you get that one sorted, because you're in Great Yarmouth. I think we probably just need to speak to the CCG in Great Yarmouth and make sure that's picked up. Oh, Trees and Twin Oaks. I guess this might be Epi. Roundwell Pharmacy and Cossey. They manage our residents' meds, help an evening clinic for our staff, boosters and flu vaccinations, which we arranged with them. We help take the people there, etc. Fantastic. And also just shows what you can do if you can contact your pharmacies to have that discussion about what services they might be able to support you with. So that's fantastic. And we have got a hand up, and that hand
It's Winnie.
belongs to Winnie. Winnie, come in, Winnie.
Hi there, how is everybody? Good morning, everybody.
Morning, Winnie.
How are you? Are you all right?
Thank you, Winnie.
Good. What I'm just going to say is all my residents have been vaccinated with 1, 2 and 3. All staff have with 1 and 2. I've got 2 that are waiting their 3rd one. I've also got a new member of staff that has had her 1st one. However, you just mentioned that she can bring it forward. How do I go about bringing that vaccination forward, please?
You should be able to go to your GP or the vaccination site with a letter to explain that you're a care worker and that you would like your vaccination sooner. There is some wording that Boyka kindly put together to explain where this information is located. Boyka, you're still on the call. Is Boyka still on the call?
I am on the call, yes. Is it about bringing the 2nd dose forward?
Yes, please. She's only just recently started with us. She's had her 1st vaccination, but obviously she needs her 2nd one to be able to come back to work.
Yes. So Pfizer, the minimum period between the 2 doses is 28 days, and for AstraZeneca, the minimum period between the 2 doses is 28 days. And I can put in the chat the government website for this. Basically, the Medicines Regulation Authority have approved these minimum periods for the 2 vaccines, and individual cases can be exempt from the requirement to have 8 weeks or 12 weeks gap between the doses. So this period can be shortened for social care workers so that they can have it timely because of the mandatory vaccinations.
So do I just have to send a letter that she takes to her GP or the vaccination clinic, and then that will be acceptable?
I think so, yes.
Okay, lovely. Thank you ever so much.
Christine, you're on mute.
Sorry, I turned that off. We had a telephone call come through here. So yes, if we have any issues, if you have any issues, Winnie, with that, do get back to us and we'll try and facilitate the discussion around that. Because what happened, for example, was one member of staff did go off to get their vaccination sooner and was met with somebody that said, no, we can't do that. We then had a conversation with that provider and it was facilitated. So yeah, just let us know, Winnie, how you get on. Personally, I would take a letter from you, from your organisation that says that, you know, you are entitled to this vaccination as you're a member of staff, social care staff, the letter that went out, and Boyka's information in the chat box. If you accompany the letter with that, then it should be fine. So hopefully.
Fantastic. Thank you so much.
That's a pleasure. So who else have we got here? We've got Tina and Gillian. Are you able to come in? Are you able to unmute? Oh, lovely. Yes. Hi,
Good
Tina.
morning.
Hi, good morning.
Right, following on from what's just been spoken, we've actually had a gentleman go off this morning for his 2nd vaccine. And they've rung us and they have spoken to Gillian and said that they cannot vaccinate him today. That has to be, what did you say, 6 weeks?
6 weeks.
6 weeks. So they won't vaccinate him even though he's been 28 days.
This is the 2nd vaccination.
The 2nd vaccine?
Yes, the 2nd vaccine. Well, I don't know where the 6 weeks have come in because that's not even in the guidance. Usually is they bring it forward to 8 weeks. That, you know, that's been kind of agreed. But for social care staff, they can bring it forward slightly sooner than that. Tina, are you able to say where they've gone? Would that be okay, or to drop a line or where they've
No,
gone? We'll try and pick it
I
up.
would tell you if I knew where they'd gone, but unfortunately that I don't know where they've gone, to be honest.
They had a list.
Yeah, we provided them with a list of places to go because there were
Right.
3 of them, and 2 of them managed to get the vaccine, but the 3rd one didn't. So they'd made an appointment to return this morning at 10, and that's why we were a bit late coming on, was because we then received a phone call to say that the person from the vaccine place said that that they couldn't do him until the 14th of December.
Right, okay, so this goes back to my point. We do need to know where this is happening so that we can unblock it, basically.
Right, we'll find out, and then we can, if it's okay, and then we'll let you know.
Yes, and then we'll speak with the CCG and just make sure that we can, you know, facilitate this.
Thank you.
Yeah, if you could just let us know where he's gone.
Yeah, they're due to be back by 1 o'clock, so we can speak with them at 1 o'clock and then let you know if that's okay.
Okay, and Boyka will say this as well. It has to be a clinical decision about bringing it forward, but if they've got no issues or their health's fine, there shouldn't be a problem with this. It's just maybe not everybody in the vaccination clinics or wherever they are know about it. So it's about raising awareness a little bit of this. So, but that's
and
fine.
Boyka's popped that information in the chat as well for you.
Yeah, there we go. Boyka's put the information in the chat, so hopefully that might help as well, even if you printed that off with a letter to say you're from social care staff.
Right, I'm being very stupid. How do I get back into chat? It's a long time since I've been on your calls.
Oh,
that's all right. So just along the top, you should see a toolbar. So with a big red leave sign. And then if you go across to the left of that, you will see second closest to the right, hide conversation. Yep, and you're just there.
Yeah,
perfect. They don't, annoyingly, they don't say chat, they say conversation, so it's a bit confusing, but there we go.
That's fine.
Is that all right?
So what is the minimum now between the 2 vaccines, please?
It's there in the chat box. It's 21
okay, thank
days
you.
for Pfizer and 28 days for AZ.
Perfect, thank you. Thanks.
Lovely. Okay, I think we've got somebody else. Have we got somebody else? Oh no, that's Tina. Okay, that's lovely. Okay, so I just want to move on to our home care colleagues as well, around the flu and the booster vaccines. I will be getting on to mandatory vaccinations, as you can see on the agenda. But firstly, has anybody in home care had any issues at all with accessing flu or booster vaccinations for their staff? Have there been any issues? Jenny, how's it going? I know Jenny and Janice. Jenny.
Really well, to be honest, Christine. We've got 100% with all of our first vaccinations, and the boosters we're having quite a good uptake. The only one that isn't going quite so well is the flu vaccination, as everybody else is saying. People are not reluctant, but not so keen to have that one. We've got a vaccination centre just behind our office, so the staff are really fortunate that quite often they're offering walk-in appointments.
Yeah.
We haven't had quite an uptake with their age group, so that's quite fortunate that staff can kind of drop in there. So all in all, it's going really well, to be honest.
Oh, that's excellent, Jenny.
Well, actually, everybody's had their second jab, so they're all on their boosters now. I think we're about 75% of the way through.
That's excellent news. That's really, really good, considering as well that you are reliant on going out to the community to get that. That's fantastic.
Yeah.
Great result. Brilliant. And Janice, are you there, Janice? Are you able to unmute? Oh, hi, Janice.
Oh, keep going. Yeah, I've done it.
Yeah, you have, Janice. Hi, Janice.
Oh,
How
yeah.
are you?
I'm fine, thank you.
Great to see you. How is it going with you, Janice, in terms of the flu vaccination and booster vaccination uptake with your staff?
Yeah, as Jenny said, really well. I've not had any problems come back. Again, the flu is the one that's been the problem because they're running out. But on the whole, I'm very lucky that my staff have taken on to have the jabs. So, you know, it's worse for care homes, I think, than it is for the domiciliary at the moment.
Yeah, yeah. So it's not necessarily the access to the flu vaccination that you're finding amongst staff at the moment. It's more, well, it's partly that, isn't it? It's partly the supply issues you're saying.
Yeah, yeah.
So there are some supply issues, and there is a little bit of resistance to it as well.
Yeah. I think they're more inclined to have the COVID jab than they are to have the flu jab.
Yes. I'm picking that up quite a bit. But also, if there is issues with supply as well, we just need to know what the issues are there, really, so that we can provide you with more details like walk-in places or access. So we're putting some links in the chat which will go out to everybody, and then that maybe will give further options for people to check to see if they can get the flu vaccine. There it does. Well, I do know there are some issues around supply.
Yeah.
And we've got something in the chat here. We've got here under Jenny. Oh, we've got quite a few actually. Let me just go back.
Yeah, we've got from Judith onwards. So Judith said all staff have found it easier to book themselves. All staff except one is double vaccinated and most booking boosters. Flu vaccine less uptake.
Yeah, it does seem to be a bit of a common theme. And then any idea why there is some resistance to the flu jab? It is a theme. Yes, it is. I know that Boots and Swaffham have been running out of the flu vaccine often. Yes, that's right. So there are supply issues. I think the whole issue about flu jabs is it's something that people don't necessarily think they will be protected against because there are different strains of flu. We do lots of we used to do lots of campaigning each year about uptaking the flu vaccination, and I think the fact that it's been assimilated with the COVID vaccine, it hasn't had the same focus on the importance of the flu vaccine. More people are thinking, let's get the COVID vaccine, and especially in care homes where it's mandatory, that's where the drive has been. So I think it's a combination of those two things about people not accepting that the flu vaccination is as important. It's partly historical and partly it's because of the emphasis on the booster, the COVID vaccinations and the boosters and the mandatory nature in care homes. Yes, here we go, Sarah. I'm picking up through calls to providers that because the flu vaccine is not mandatory, staff are exercising their right not to have it. Yes, I think that's right. I think it's a combination of things. So we definitely need to do more in terms of raising the awareness and the importance of the flu vaccine. I think that's something, I think maybe Judy's left the call, but Stephen, I think we need to work with our CCG colleagues to try and do a little bit more campaigning around that, I think.
Hi, Christine. Yeah, I'm sorry, it's Rowan. I'm back.
Rowan.
Yeah, I can certainly bring that up with colleagues and see what we can do.
Yeah, it definitely is a theme, and I do think there is this view. It's not mandatory. We don't need it. And it's not just that, it's also partly, we mustn't just say it's about hesitancy among staff. There are supply issues and there is issues about accessibility for the social care staff. So there's a couple of things.
Sorry, Christine, I'm just wondering if Boyka's team would routinely send out any comms around promoting the flu vaccine or not?
Oh, I don't know.
we can do that. We certainly have had a lot of communication promoting the coronavirus vaccine, particularly among disadvantaged groups and in deprived communities, some ethnic minorities that are more reluctant to be vaccinated. So we've done very active promoting campaigns, and we are working very closely actually with the CCG. So it's joint working to promote both flu and COVID vaccinations. So we can look into that.
We could have a separate conversation about that, Boyka,
Yes,
couldn't we?
yes,
Yeah.
let's do that.
That would be extremely helpful. And as Mark's put in the chat, I'm not sure of the statistics, but flu deaths in an average year will probably outweigh the current COVID death rates. Yeah, and he tries hard to educate his staff on this, and I think that's the point. It can be a killer, and so we definitely need to educate as many people as possible about that. Yeah, so thanks, Boyka, and thanks, Rowan. It'd be great to take that up. That would be fantastic. I just want to focus a little bit on the care homes and some of these issues. I'm just going to take them all together, but has anybody from the care homes got any issues about recording vaccinations, not forgetting that we need to ensure that you update your capacity tracker, which I'm sure you all are doing, but about being aware of how to record vaccinations, any HR issues that you might have in terms of people leaving or having to leave on the 11th of November, any issues around self-exemption or the end of self-exemption, and finally any issues with either health or tradespeople wanting to enter the premises without producing evidence. Have you had any issues of that? So does anybody from the care homes have anything to say around the actual sort of the process of recording the vaccinations and also being able to evidence the vaccination? Have any of you had any issues? Because we have in the past definitely had issues in this area. I'm just going to go to somebody who mentioned something before the care homes. Where are they? Gayatri, in the chat box, would you kindly sort of make any notes here about, have you had any issues about people trying to come into your provision and not providing evidence of double vaccinations, whether that's, you know, people coming in to do the boiler or heating or repairs or anything like that? Have you had any issues with that? If you could pop it in the chat box. And I'm going to ask both Rajes again. Both Rajes, have you had any issues at all with any of these issues?
Oh, Zoe Gree's got her hand up just quickly as well.
Okay, Zoe, except it's not Zoe, is it?
No, it's me. Zoe is here. That's Carolyn.
Carolyn.
The only issues that we've had so far, I mean, it's very early days yet, isn't it? So
yes.
We've had issues with some agencies where staff have been booked in and they've not been double vaccinated, so obviously that shift has then had to be cancelled. And one company, electrical company, there was one of the members of staff that there was two people supposed to be coming in and one hadn't, but we checked prior to that. So okay. Our organisation has been making sure that the people that do regularly come into our services are aware that they should be double vaccinated, because that was one of the issues that we found leading up to this, was that we were having district nurses coming in to both the services that I manage, and they hadn't been made aware that they needed to be double vaccinated to come into a registered service, and their bosses hadn't said anything to them about it either, which was concerning, because we were then only a few weeks away from it being mandatory, and there's some of the people we support need the district nursing daily or whatever. So just seemed that a lot of people left it right till the last minute to do something about it, especially the agencies that knew, you know, they know the services that they provide for, and it was common knowledge that for registered services, people had to be double vaccinated from that date onwards.
Yeah.
But there were only 2 minor issues with it so far, but it is early days yet, isn't it? So
yeah, okay. But it's good to keep a check on it and monitor it. What we've been advised is that all health professionals have received or have access to communication around this, and it was sent out to them. So we were told it was probably because they hadn't read the communication. Yeah, so I don't quite know what to say to that, but that's what we were told. The second thing is around others coming in. Like you say, Caroline, it is early days and perhaps people aren't just aware, you know, more generally in the business world about the need for double vaccinations, and that'll be more evident the longer this goes on. And the fact that you checked before people came in is brilliant, isn't it? Because the last thing you want is people turning up and then having to turn them away. So that's great. We were assured that health professionals will be reminded of the letter. Stephen, I don't know whether you're there, just picking up on the agencies, and I know we've got Robert here today from an agency. I mean, Robert, you're aware, aren't you, that because you've been explaining that people have to be double vaccinated before going to care homes. So I presume your agency would ensure that somebody is double vaccinated before they go?
Yeah, we are very aware and we have been encouraging our staff, but I think, you know, across the board, most of the agents workers were unwilling, you know, to have it. And some of them did not take it serious. We have some who had double vaccinated already prior to this, but some were sort of not believing it until they realized then that it's quite a serious game and nothing is going to change. But I'm quite sure in the next few weeks, most of them who should have received the second dose. Yeah.
Okay.
Yeah.
So in terms of procedure or policy, are you aware as an agency you should not be sending staff that have not been double vaccinated to care homes?
At the moment, we are not safe. From last week, we are from the 11th, we are not sending anybody who have not been double vaccinated.
Excellent.
And we are asking them to send us the proof of their vaccination. Yeah.
Okay, that's great. Thank you very much. That's helpful. Stephen Long, are you on the call still, Stephen? I just wondered, Stephen, is this something that we might be able to write out to all agencies and remind them of double vaccination in case people it's something that they have missed, to remind them?
Yeah, this has already gone out in comms, but we'll continue to work with agencies to obviously make them aware that they can't send non or double vaccinated individuals into care settings or into residential settings, sorry. So there's a piece of work we're already doing through Tim Weller, and we'll continue to work with the market and the agencies to ensure that we're offering any support we can to ensure that it's happening.
Thanks, Stephen. Thank you. I know that you had written out to the agencies before, but I suppose it's just that communication that needs to be constantly reminded, isn't it? The importance because of the mandatory vaccinations on the 11th of November in care homes. So thank you. Oh, we've got a hand up here. Cheryl.
Hi. It was just to Cheryl Hicks, one of the care provider quality improvement nurses. It's just to ensure that information has gone out to the recruitment agencies as well as the CQC regulated domiciliary. I don't know.
Yeah, that's what we're talking. Yeah, Cheryl, that's what we were talking about. Yeah.
Okay.
So when we say agencies, we mean non-regulated.
Yeah. Okay.
Yeah, so these are like recruitment agencies. We don't use the term agencies for our regulated services.
Lovely, thank you.
That's great. Thanks, Cheryl. You're right though. Great. Okay. Well, if nobody else has got any more questions around even exemptions or anything like that, we'll move on to the next agenda item, which is mandatory vaccinations for the wider health and social care workforce. Now, this is obviously something that came out just last week. We've got the guidance for it, but obviously this impacts all home care, supported living, extra care. The only umbrella domiciliary service it doesn't cover is shared lives. So just from the home care and supported living sector perspective, what are your thoughts, and what sort of support might you think you need? Oh, here, Raj, would have been so much easier if the dates for mandatory vaccinations would have aligned for health and social care to avoid confusion. Absolutely, Raj, couldn't agree more. Couldn't agree more. Yes, but the consultation went out initially into care homes. If you read the feedback from that consultation, the reason that they identified care homes first was because of the number of deaths in care homes and the priority they attached to care homes, and said that required immediate attention. So that's why that was focused in care homes initially. That was what the government said in their consultation, not what we say, that's what the government said. So that's where we are. So in terms of home care, how are you feeling about this, and what do you think might be some of the issues that could arise? I mean, I've heard today from some of our home care providers that are fairly confident about accessing the booster vaccine and the flu vaccine. That seems to have gone down very well. People seem to be engaging with that. Oh, Mark, come in, Mark.
Hello, good morning.
Morning, Mark.
I think there's two different sectors here, hasn't there? I mean, for us, we're going to take advice off our legal team, and we will build this into all new contracts of employment. So in a sense, from this point forward, we won't have the problem that we may have now with people who are reluctant. So we'll get that built in. And I think it's a shame that when you sort of look at what the government have put out, they're not including the flu. And it's going to be, it's difficult, isn't it, to try and encourage those few staff who won't have the flu if even the government don't seem to take it important. But as I put in the chat there, we're talking about 17,000 people a year possibly dying in a normal year. So I'm surprised and a bit disappointed that they haven't put that in. I think we will take legal advice for all new employers. We will probably see if we can put the flu in as well as any COVID. And I think we also have to also understand that there could be other types of viruses. So it's almost got to be slightly ambiguous, all-encompassing wording, because nobody foresaw COVID coming, did we? So it has to be any future epidemic. With regard to frontline care workers now, I'm confident we won't lose anybody because they've got the get out of the flu. You know, they'll say, well, all right, I will have the COVID, but I'm definitely not going to have the flu. And in a way, if that's the payoff, well, that's it. Yeah. I don't think we'll lose anybody. I don't think it will sour relations, but I think it does give every provider an opportunity now to consider what goes in the new employment contracts for the future and for all new people.
Thanks, Mark. Thanks. Certainly when the care homes realised that they were mandatory vaccinations were being introduced, some of the associations supported the care providers with template documents and so on to support them, and also you know, larger organisations as well had their own HR departments look at those. But certainly I should imagine it's changed its name now, isn't it? Home Care Association would probably be looking at that as well. So hopefully you'll get some support from some of those organisations that support that sector as well, like they did with care homes. Raj, you had your hand up.
Yeah, I was just going to say it'd be interesting, Mark, if it's possible to share the outcome of any advice that you get for the group. Just to see, take a different perspective on it. And I think there's got to be a forum for sharing information like this. And you know, perhaps even splitting the cost of it as well, dare I say, you know. The other thing I was going to say is that, yeah, we lost about 4 people that went to the NHS because they thought, oh, well, they don't have to get vaccinated there. We actually lost 1, and then 3 followed very quickly in succession. So the damage, I guess, from our perspective, had already been done. We're not going to lose any more because the date has passed. But a lot of places have already lost the staff, and that's causing, you know, quite a big sort of shortage in staffing in care homes up and down the country, not just here in Norfolk or locally. And I don't know whether there's any sort of proposed solutions to how we're going to replace these staff in the short term and the long term, because it seems like everybody's short of staff, and it just seems to be one thing after another, and whether it's low pay or whether it's been forced to have the vaccination or better positions outside social care or better offerings from the NHS. You know, I think the vaccine was the sort of, you know, a straw that broke the camel's back, really. And I am an advocate of having the vaccine. I think everybody should have it, but it was just the one tipping thing that really, you know, was not great for staff morale. Even though some had it, they didn't want to be forced to have it.
Yes.
And I think education would have been a better route. Like Mark has just pointed out, you know, the figures on how many people die of flu. You know, we probably all knew that somewhere in the back of our minds, but you know, those sort of figures are quite powerful. And maybe that's the thing, that we need better education amongst staff. You know, I mean, Richard was saying earlier that some of the staff didn't know that it was so important to get vaccinated, otherwise they wouldn't be able to go into care homes. Clearly, the message coming through to me is that there was a lack of education and a lack of understanding. And we can sit here and talk all we like about what we've got to do and when we've got to do it, but if the staff on the ground aren't taking this seriously or don't have that understanding, how do we communicate that message across to them?
So Raj, just to pick up on that, I think you're absolutely right. It was about winning hearts and minds of the staff, and at the very beginning of this process, and you know, I've got public health and Boyka, and I've got Rowan on as well here. We recognised that the take up was quite slow and low, and so we did a lot of work to get information out, lots of resources, lots of videos, etc. But we also ran Q&A sessions as well with staff at 2 separate times to encourage the take up, and we have regularly contacted care providers and provided them with information. I myself have done some work directly with the GPs, with care homes themselves, to facilitate those conversations directly with their members of staff. And as a result, we've got 96.4% of the staff in care homes that have had their first vaccination. That's a huge percentage, huge percentage. And so I think we have done exceptionally well in Norfolk, above what we've done in the best. We're one of the best in the region.
Oh, I absolutely agree. I think, you know, to not just the region, but the nation as a whole.
The nation, and nationally, yes, absolutely.
This number of people vaccinated has been fantastic, but it's that 4% that, you know, have left the sector possibly, that, you know, at a time when we need them the most.
Yeah.
That's the, you know, that's the bit that we need to target. And I think, you know, going back to Mark's point about the flu, you know, how do we get that message across to the last few remaining people? Because you know what, we're all desperate to hang on to our staff. Every single member of staff has a huge value to us at the moment in terms of covering shifts, just, you know, people, experience, numbers, whatever you want to call it. And you know, to lose them at this point, weeks before Christmas, is devastating.
It is, and we're still not absolutely certain what the final impact is, Raj, because whilst the capacity tracker will give us the number of staff that haven't had their first vaccination, including exemptions, that is, there's still a number that haven't had their second vaccination. So there's this lag as well, and we still won't know completely until the 24th of December, because there, you know, people have been made themselves self-exempt, and we don't know how many of those will actually be medically exempt at the end of that period. So the numbers are still unknown to us, but we do know, like Sarah has put in here, we know that we've lost 163 staff across Norfolk since the 17th of September, but we might lose more, and probably will lose more, by the 24th of December, because either they're not medically exempt or won't take their second vaccination. So the numbers are still not known completely, but you're right, Raj, as well. People did leave to go to the health service, but they're now going to have to get their mandatory vaccinations. So that's going to be short term as well, isn't it?
I mean, in terms of figures, my understanding is that, you know, some 30-odd thousand people haven't been vaccinated in social care, and a similar number have left the sector because they didn't want to get. So, you know, look at a shortage of like 60-odd thousand people up and down the country. I mean, that's significant when we've got 105,000 vacancies already. So, you know, that figure of 100,000 vacancies is going to jump to 160, 170,000 by the time Skills for Care produce their next sort of figure, unless we start doing something now. And you know what, I don't know what people can do. I mean, where are we going to get people from?
Well, that's the $100 million question. I suppose this forum is probably not the best to talk about strategies around recruitment and retention, but they are being taken up. There is some funding available, and there are some measures in place and initiatives, but nobody has a magic wand. If they did, it would all be fixed by now. So
well, there is a magic wand, and it's held right at the top, and somewhere along the line they seem to, you know, not be using it for social care. I'm sorry, but you know, the policy can be changed to make sure that our staff are looked after, as well as, say, the NHS, and also we have the ability to recruit freely, you know, from not just our local sort of commutable distance, from an international market like the NHS. Why are we treated separately? And I agree, it's not the forum to discuss it. But, you know,
the forum to discuss it, but you're absolutely right, and all of those discussions are taking place in other arenas. But it touches on a point about what could we do now for the rest of the social care staff to prepare. So like Mark's saying, let's look at our contracts, let's look at our processes, so that we don't get to the 31st of March and think, oh goodness, what should I have done? It's about being proactive and planning. So one of those things is looking at HR issues, is getting your paperwork sorted, going to your associations, asking for support, like we did with the care homes as well. So we got templates as well for care homes as well. Finding places that will support you. I'm sure what was the UK HCA, which is now, I'm sure it's called the Home Care Association, I'm sure they will be looking at this. I'm positive they will. But that's the sort of thing we need to you know, support.
ADAS this morning sort of announced that they wanted to pay like a winter bonus to all care staff. Maybe that should be attached to, right, if you have your flu vaccination, you have your COVID vaccination. Yeah, Wales and Scotland gave all their carers sort of £500 through the pandemic. If we did the same and attached sort of various conditions, and anyone who's there from now until March that's had all those vaccinations, give them a £500 bonus like they did in Wales and Scotland.
There is some funding that's come through the local authority via DHSC. We've obviously got the infection control funding, but we've also got recruitment and retention funding as well. And there will be some funding going out to the care sector very shortly. I don't know, we've got hands up. I'm just making sure.
Yes, we've got Jenny's hand up as well as Mark.
Yeah, I just wanted to check with somebody from Norfolk County Council. Charlie, are you on the call? Charlie?
She is, yeah.
Charlie, did you want to come in and just explain what might be happening in terms of the recruitment and retention funding and when the providers might hear?
Well, it was discussed this morning and it'll be going to members shortly for a decision, so hopefully in the not too distant future.
Okay, so there's a set of proposals that have been made. As soon as they're signed off and agreed, the sector will be hearing about some funding that will be coming to you. So it won't be, as I say, the panacea, Raj, but we've got some good news on the way, some. But we need transformational change, I think, to really make an impact. I'm just going to go now to, I think, Jenny, you had your hand up, and then I'll come to you, Mark, afterwards as well. I think
Thanks, Christine.
Jenny.
Just wanted to recognise Raj's points around retention and recruitment. As a business, our retention is going to be okay, I think, but we have challenges in regards to recruitment for staff coming in and around what we're going to do as a business to support with COVID. But I was on a meeting yesterday with Norfolk and Chris Jones, and they announced that they're running 2 campaigns, which might be for Raj and some of the other providers. So they're doing a local recruitment campaign called UCare and a national recruitment campaign called Made with Care. So all providers can sign up for that. So we're going to do that as a business, but that might be helpful for anybody else on this call, and that can be accessed from Norfolk Care Jobs at norfolk.gov.uk, Raj. So you can sign up for some virtual events. They're going to put 1 home care provider, 1 care home and 1 day centre on each of those virtual events. And I know that they've got an event coming up in Norwich and Yarmouth shortly. So that might be helpful for anybody else who's struggling with recruitment. They've also put the adverts out on TV, and that's all free. So that's really, really great. ITV and Sky.
Thank you, Jenny. Thank you. And there are some other initiatives as well, but the reason that we can't say more is they've got to be signed off from the council at the moment. As soon as they are, then there is even more supporting initiatives that will be introduced to support recruitment. But those campaigns, one of the things that we picked up from our subgroups for Norfolk Care Association is that many providers said, you know, the campaigns for recruitment just need to be more visual. They need to be much more regular. And one of the things that the local authority have agreed and done is funding for longer than just 3 months. So there is going to be, I think it's 18 months funding towards supporting these recruitment campaigns. So there won't be this stop-start. It will be a regular feature. Things will be on the news, in the radio. There'll be changes in terms of focus on different parts of the market and so on, and you know, different groups within the market. You know, maybe we want to target more men working in social care, maybe we want to target younger people, maybe we want to target older women, whatever. So we're just gonna look at that throughout those 18 months. So that's something that's on the cards. Mark, you've got your hand up, so I presume that's not an old hand, Mark.
No, well, it is an old hand, but
well, you know,
in terms of this thing, no, I'll re-put it up. Sort of coming back to what you were saying, Raj, but also back to number 3 on this agenda. It was, what are the implications of these mandatory vaccinations? And we have looked, haven't we, on retention. But I also wonder, and I just wonder what other people think about, is there, do you think, a negative effect on recruitment with regard to having the mandatory vaccinations? Because we have focused on losing staff, But you said, Raj, where are we going to get these people? We have 4.5% people unemployed in this country. We keep being told how many people are unemployed, and many of them will be very suitable for care. And I have to say that when we take people in here, especially, and I love having people outside of care, there's no point us fishing in the same pool. We need to be bringing people across sectors. I always try and make it a selling point. I say, of course, one of the bonuses is you are going to be paid and you're going to get your vaccinations guaranteed every year to keep you and your family safe. So we try and sell them the mandatory aspect. So in fact, we don't even call it mandatory. This is a gift we're giving you to come across. But I wonder whether other people may share views that some of the reluctance to come into care is because of the mandatory aspect, and has it been over-engineered? Because it's a necessary evil. We must have mandatory vaccinations, but it's how we sell it.
Yeah, Mark, just on that point, I've done some job fairs at the local Kings Lynn sort of job centre, and I've been there quite a few days, and a lot of people ask, do I have to be vaccinated? And you say, well, yes, you will be from this date, and immediately they sort of walk away and they say, well, it's not for me then. So it is something that you know, we do try and sell it any way that we can. I mean, I've camped out at the job centre for many a Friday and a Saturday morning, you know, just trying to talk to people, and you know, it's difficult. You say there's 4.5% unemployed, but I would equally argue that there's probably 3.8% unemployable or don't want to be employed. You know.
Raj, I think again this is a kind of conversation that we need in probably a different forum, but just to say that again, it's a piece of work that we're doing with the job centres as well. So for example, myself and my team spoke with work coaches across the whole of the county in job centres to promote social care as a positive career, because sometimes what we find is that the job centres coaches themselves don't promote social care in the same way, or don't challenge some of the myths that often arise. You know, things like, oh, I have to do this work I couldn't do. I don't get paid for travel. All these kind of things. So we met with 150 work coaches across the county to explain what working in social care is about, and we will be working with the job centres on a number of initiatives across the whole county in this coming year to support training and access to the social care sector. So that's in the back pocket, Raj.
Great.
Just to say, Janice has got her hand up as well.
Janice.
Yeah, just to say that 2 weeks ago I done a jobs fair in the Forum at Norwich.
Oh yeah.
We had a fantastic day. We were over the moon. We came away with 45 applicant names.
Excellent, Janice.
Yes, but
okay.
Contacted that afternoon and the following morning, and we ended up with 3.
I think, yeah, okay. There's the reality of it. It is really, really, really hard work. We have been to many, many jobs fairs and done many, many of these pre-employment programs. I think when you have a jobs fair, you get lots of interest, and you really do, don't you, Janice? You get lots of people coming to talk to you, and they all express an interest. They walk away, and very few actually take it up.
Yeah.
I think the difference that we want to make is having a program behind it, so that you get people that are interested and do some training and do some support around it. So that's what we're looking at. You know, can you remember, Janice, we've done those before. They used to be called sector-based work academies. They're now called SWAPs. They're sector work academy programs. It's just a name, but that is about providing people that are interested with more structured learning, even if it's a week, and then support to get into employment. It is hard work, but you're going to get more that are suitable by doing that.
Well, we've got names now that we can keep in contact with, and we did have some that said Yes, I am interested, but I don't want to start before Christmas.
Yes,
Yeah.
absolutely, exactly. It's one of the reasons that we probably won't be doing that sort of work before Christmas.
I'm at Great Yarmouth tomorrow, so we'll see how we get on tomorrow, because there's another one there. So, you know, we'll try that one.
Janice, good luck. Good luck, because that's all you can do is keep trying.
Yeah, yeah. It's just trying. We're just trying everything we can, because we know that the work is there, but we just cannot take on work now, because we can't run a safe service, and that's what it's about. If you can't run a safe service, then you shouldn't be running that service. So.
No, absolutely, absolutely, and that's why we come back to the thorny issue of where are we going to find these staff, because unless we find the staff, we can't run at the full capacity that everybody would like to do. So we're all going to have to work together to try and find staff and retain them between. So thank you, Janet. Thank you very much for that. I'm just going to move us on to the last item on here, which is IPEC funding. Is everyone aware that on the Norfolk County Council website, there is information about the Infection Control Fund and how it's going to be distributed? So basically, the government announced that there's going to be a further round of infection control funding from October the 1st to March the 31st, 2022. Each local authority was given a sum of money, and then that local authority had to meet certain criteria about how that could be distributed. Then there was the proportioning out according to needs. So on, I'm going to pop it. I don't know whether actually, I'll do it now actually, because I've got it here. Megan, I'll do it there. I've got it. That's the website, and that will give you all the information about the infection control funds, and it covers. You'll see who it covers on here, and where the money is going to go, the care homes and the community care providers. So please, if you haven't seen it, it's there on the chat box. You will need to have to complete a form and so on, as you have done before. But remember, the period is from the 1st of October to the 31st of March 2022. And I believe I've got a date here as well. It's well worth looking at for DomCare. Yes, it is, absolutely. Who wrote that in the chat box? Marks. Yes, it is, absolutely. There's some really good incentives here. It is definitely worth looking at, and it is very supportive. So hopefully that will be of value to you. I mean, I can go through some of the information if you want, but it's very, very well laid out there. So just sort of key points are
the 22nd of November is that key date I think you were looking for there, Christine. Yeah.
The 22nd. The payment date for compliant providers is the 22nd of November. So yeah, definitely go and have a look, see what you can apply for, and it will cover what you can use it for. And again, you know, if you're not sure what you can do, you can always contact the local authority to find out a little bit more about it, or even send us an email and we'll pass it on. So hopefully that will be very useful for you. There's some great stuff as well for care homes. Sorry,
Christine, Christine, can I come through, please?
Yes, of course. Is that Raj?
Yes, yeah. Just, you know, regarding these funding, I mean, round 4 now, when I started to input the on the website, the claims, and suddenly I realized that there was not much I could claim it, because I didn't have any COVID infection in my care home. None suffered, and most of the things I had to return back. Because there are very certain areas they couldn't do it, and that made my life more difficult. There are others I did spend a lot, but I couldn't do it in that category, so I lost out on that. So hopefully they have other items on there, that you can actually claim it. So make at least you can get 50% of what they give you, at least, rather than return everything back. That's my issue.
Yeah, it does look a little bit more encompassing. because there's an ICF element, a testing element, and a vaccine element. And they're talking about a certain amount going to care homes for ICF, a certain amount going to community providers, etc. Where are we going here? Find out more information on testing measures. Have a look at it. If you still feel that that's not going to be particularly helpful for you, they do give you more information on what you can spend, because you have to each part is separate. They separated it into, as I say, 3 parts: infection control, infection ICF funding, testing element, and vaccine element, and each part has separate criteria. So go and have a look, and if you still feel that that's not very helpful, do come back to me, Raj,
Yeah,
and,
okay.
you know, I can see whether or not that's the same for everyone. I can put that out through Norca to see whether other providers feel the same. So please keep in touch with us.
Yes, I will. Thank you.
Okay, Raj. Okay, so I think that was it. That was what we had on our agenda.
Yes, it was just any other questions and then close.
Yes. Yeah. Okay. So really, it's over to you. Anybody in the call that's come that might have a query around the matters that we've discussed today. Raj.
Oh, Raj,
Right,
is that
okay.
an old hand or is that?
No. I just done it. It wouldn't come on my screen, but hopefully it came. What I was wanted to know, is there any news on the LAMP? You know, the testing thing. No, are they gonna be passing on to the care homes, or is it just keeping in the hospitals? And
I have spoken to Irene Carews about this, and again, I don't know whether Boyka or Rowan are still on the call at the moment. But initially, this is through health at the moment. It's being piloted through health, and then looking at the wider application. So
it's Rowan here. I know it is being rolled out, as you say, through health. It's about to be rolled out in primary care. I don't know, Boyka, do you know anything about the timescale for care homes staff?
I'm sorry, I don't know the timescales, but we can check with Irene and we can update
probably need to
this
check with
group.
Irene, I'm
Yes.
afraid.
Yeah. I think the whole thing about it is because it's new and because they have to go through all the clinical governance, don't they, Boyka, that they have to make sure that each step has that clinical governance in place before they extend it. So it's not universal at the moment. It's being rolled out gradually. And Irene definitely said that at the moment it's not being looked at in care homes, but or care sector, but it's not to say it won't be. And just for those that don't know, the LAMP is a form of testing, which means you can get results on a quicker basis. It's basically a new method of testing. So it's a pilot at the moment within health. I don't know, Rowan or Boyka, if you wanted to add anything more to that.
It's a saliva test, so it is easier to, well, in some respect, easier to administer. But of course, for some residents in care homes like dementia patients, it might be more difficult. So it has its pros and cons. One advantage is that it's quicker, faster to get the results, and it is saliva test, so it's less invasive, less discomfort with the test, but it might be more difficult to administer for patients with dementia or with learning disability. So, but we will investigate any timescales for implementing this in care homes, and we will let you know.
So somebody's asked about the reliability of it, and I think the accuracy of it is reported to be very good. Yes. It's got a high
high sensitivity and high specificity.
Exactly.
So it is comparable with a PCR test. So it is a very good test.
I think you mean LFDs, do you, Raj?
Yeah,
LFDs, yeah.
it's got better accuracy than LFDs.
Yeah.
Yeah.
Yeah. Mark, you've got your hand up.
Yeah, just quickly, I was just looking through the letter that Norfolk County Council sent out with regard to the new infection control. Christine, I know that you've got direct links there. It just might be worth pointing out on page 2, it says that the grant agreement has to be completed by the 12th of November. And I thought it was the 20-something because we only received this by email a few days ago.
Yes, I suspect that might be a typing error.
Yeah, can I just ask you to check back with them, because obviously there's going to be people who may not apply for this.
Yes.
But I'm sure you said the date was on the 21st, wasn't it, or something?
Well, it says it's a bit more difficult than that. This is the payment date. The payment date is planned for the 22nd of November. So it assumes, I think, people have already applied, actually, when I look at it.
Because this letter was only sent out dated the 4th.
Only the 4th. Okay.
Dated the 4th, but it says by the 12th, but we certainly didn't receive it on the 4th. We only received it at the end of last week.
Okay, so
if you could just check that one for us, I'd appreciate that, please.
Absolutely. Charlie, you're on the call, aren't you? I think we probably do need to go back to the team, don't we, Charlie, and just check to see if we could extend that date.
Yeah, I do think that it was a really quick turnaround. It's the nature of the funding that it's only like a 10-day window to apply. And then there's another deadline for when you're to have your completed financial forms in. But I will take that back, that it's, you know, you got it later than the 4th and you had a shorter 10-day window, and whether there's any hope of an extension.
Yeah, absolutely. I mean, presumably, is Sarah still involved in that? Sarah Armitage?
Yeah, she's the project manager.
Yeah, let's talk to Sarah, because I'm sure Sarah would agree that that's a very, very quick turnaround, especially if it's meant to be 10 days and they didn't get it till after the 4th. It's not 10 days.
No.
But we're sitting here on the 16th, so we do need a quick response, don't we, and a letter out. We have in the past extended it, so not to say it could be done, but we just need to ask the question. Let's do that, Charlie. Directly after this, let's get in touch with Sarah and see what we can do, Mark. Excellent. Okay, well, I think that's it from everybody. I think that's what we've got. We haven't got anything more in the chat box, but as always, thank you very much for attending. Thank you for all your questions and hope you found it useful. And again, we'll send out a link to the recording and links as well to information that has been raised during the discussion today.